So I want to talk about a couple things. We've heard the term like fibromyalgia. We've heard the term irritable bowel syndrome. Well, this is interesting because this topic is the topic that really got my interest early on in my practice. So I started my practice in 1992. And at the time, I started as a family doctor. And at the time, I was already interested in psychiatry, but I didn't think I wanted to do it full time. And at the time, we had 3 SSRIs out, Prozac, Zoloft, and Paxil. In 1993, a year after I started practice, Effexor XR came out, which was the first SNRI. So it worked on serotonin and norepinephrine, not just serotonin. And then what happened is I started seeing people coming in like, what is this you gave me? My neck and my back are better. I used to have so much tension in these muscles here. God, it feels so much better. My headaches are gone. I was diagnosed with fibromyalgia before, and it caused all these joint pains. So fibromyalgia basically is scattered like joint pains and muscle aches and pains. You can't really pinpoint it. There's no diagnostic test for it. So what are doctors going to do? They're going to look for autoimmune disease. They're going to do a bunch of blood tests. They usually come out negative. And then they're left with, we don't know what it is, so I guess it's fibromyalgia. Or, what's irritable bowel syndrome? So if people are having like bowel like irritability, cramping, bloating, diarrhea, constipation, and kind of irregular bowels. But people are going to notice a stress relation. When I point it out to them, I go, do you realize when you're under stress that you get, yeah, I do. Whenever I get under stress, yeah, my stomach is really, or my joints start aching and paining. And so why is that? And this is what fascinated me in 1993. And then that whole rest of that decade, I was just fascinated so much by it. And I started seeing all these miracle things happening. And I thought, it's got to be the norepinephrine. And that's the only thing that's different. And why is the company not talking about these things? I went to training to speak for the product, and I asked the people in the company, why aren't you talking about the pain issue, the anxiety? They're better for anxiety, they're better for pain, they're better for fibro, they're better for IBS. Why, we can't talk about that. We can only talk about depression because that's what we marketed it for. So they can't talk about what they didn't study it for. So, and then after that, we had Cymbalta, we got Pristiq. Pristiq actually is the same company that made Effexor, but they tweaked it and made it even a little bit better. And that's the #1 medication I prescribe in my office, by the way. But this SNRI discovery with me is really what led me into doing what I do full time. Because about 10 years after my practice started, in like the early 2000s, is when I gave up being a family doctor and I moved into this full time. And that's what led to my books. My first 3 books, Healing the Mind and Body, are all about this topic, this mind-body connection. So what's going on is that, when the brain goes down through the spinal cord, the nerves branch everywhere. They branch your fingers, your toes, every part of your body. If you feel anything you touch, you can feel it. It's because there's nerves everywhere, all throughout your body. There's lots of nerves, to your organs, to your around your gut, your intestines, your stomach. So you got, and then your neck. Probably the #1 symptom I see with stress is right here. These muscles, upper back, right there. So this is massage therapists spend a lot of their time here because that's where people store their stress. And then those muscles can come up and they wrap around the head, and so that's what can lead to headaches and tension headaches. And there's a host of things that stress causes, but those are some of the big ones. Back pain, acid reflux, because the stomach acid starts to churn. A host of things. And so neuropathy. So a lot of things that anxiety can do in the body. But that's what's going on is that's because of the central nervous system and because of there's a disruption. And so what's happening is there's a disruption in the flow of the neurochemicals because of these imbalances. And if you've seen my other shows, where I'd write on the board, I write the synapses and how chemicals are moving. So what's happening with these patients is the chemicals are not moving properly in the right way. They're moving backwards more than forwards, and they're not efficiently moving through the system like they're supposed to. This is where medications come in. So when I think about these problems, I think about norepinephrine first. So whenever I see someone with any of these physical problems tied into motion, I always start with the SNRI. Pristiq is number 1 for me. Number 2 is probably Effexor XR. Number 3 is Cymbalta. Number 4 is Fatsima. And then let's say that resolves it. It sometimes does. That's all it takes sometimes, and it's better. So let's say it's halfway better. What's the other chemical I address is GABA. So GABA is the second one I look at when I think about physical symptoms. And now we have gabapentin, we got Topamax. So those are probably the 2 I use most for pain, anxiety. So both of those also help with pain and anxiety. Topamax is kind of had an added extra benefit of weight loss, which a lot of people want to do with all these new weight loss products. So Topamax is a really safe, effective way to lose weight because it curbs cravings. Because when people are under stress, they stress eat. Comfort foods, carbs, sugars, binging in the evening. So stress eating. So when people are doing that, and I put Topamax in the evening, it curbs, not only curbs the appetite, but it curbs the anxiety and it curbs the pain. So sometimes an SNRI like Pristiq or other combined with a Topamax, or Topamax is my number 1, gabapentin is my number 2. That combination can be very powerful when it comes to these somatic, which means when I say somatic symptoms, it's physical body symptoms. But this connection between the brain and the body is very real. So that's why I call it the mind-body connection. And it's a very powerful thing, and most doctors don't understand it. They don't treat it. They don't know how to treat it, and they don't know what to do. So what do? They give pain pills. They give anti-inflammatories. They give muscle relaxant. They give whatever they can to try to reduce symptoms. But with my practice, I'm not focused so much on. I want symptoms gone, but I want to get to the root of why are the symptoms happening in the first place. So instead of just throwing a Band-Aid and covering up the symptoms, I go underneath. I call it going under the hood and finding out, well, what's causing these symptoms? The person has an anxiety disorder, of course, or the person's depressed, or the person has both. I mean, a lot of people have depression and anxiety combined, and so so when you treat the fibromyalgia and the IBS, you treat the depression, you treat the anxiety, you treat everything at the same time because it's all connected. And so anyway, so it's a topic that really, like I said, it really got me interested in this topic from the very first decade in my practice. And then ever since then, that's all I've done in the last 20 plus years, probably almost 25 years at this point, is all I focus on is this topic and treating people. And the way I do things is differently than a lot of psychiatrists do because I didn't train like they do. Psychiatrists don't train on the physical body very much. They train on the brain. Most primary care doctors like me train on the body, but not so much the brain. And so it takes the putting them together, and that's kind of what I did in my practice and with writing my books, is realizing that there's a lot that's being missed out there, and because doctors are missing the mind-body connection, they're not catching it, and people aren't getting the help they need because they're going to the doctors who don't know what to do about this. And anyway, so if anyone is suffering with these things, there is an answer. If you're not getting an answer from your doctor, contact my office. I can make you a patient, and my office, I'm taking new patients, and I'd be happy to help you with these things. And because it's all very, very treatable. You don't have to be suffering needlessly anymore. Because there's an answer. The answers are there. It's just that you need to go to someone who knows how to use these tools that we have in the correct way. So anyway, hopefully it can help. Like I said, if you want to contact me, you can contact me on my website, drpaulcoronamd.com. That's DR for doctor, MD for MD, medical doctor. So DR Paul Corona MD. My office phone number is 949-481-0118.